10 days out. I'm able to walk. I can stand up here and show you. I don't know if it'll show you a little bit, but this is, my camera's gonna be blurry. This is my ACL knee. They made an incision here, an incision here, 2 incisions here for the arthroscope, and then they went in here, and that's where they kind of put in the new ACL. This little guy up here is from where they had the sutures to pull the ACL through. This is where they took my patella, and sorry it's blurry, I'll try to back up a little bit. This is where they took my patella. Nothing else to this knee. Weird thing is, and this is the thing, when you get your patella taken out, they have to cut through nerves. So basically right here, this whole section right here is numb. It may or may not come back, I don't really care, but it's just a weird kind of feeling. It's numb. So yeah, as you can see, I mean, I'm, like I said, 10 days out. I was off painkillers, I don't know, 3 days after. They want you to lay low the first week. I'm not saying that they're like, hey, go ahead, you know, go golfing or anything like that. They want me to really stay low, but my doctor wrote a book. I don't know if you can see it. It's called Knee Surgery. And basically the first half of it is the mental aspect of a knee injury. And then the second half is like all your exercises. It gives you sample exercises, what to do while you're recovering, what food you should be eating, what vitamins you should be taking. That's one of the reasons why I picked this guy, is because he really knew his stuff. Everything's been going good, bar, you know, knock on wood. My first full physical therapy appointment is tomorrow morning. I'm going to try to do a video talk about that. They'll probably give me some stimulation in my knees and have me do stuff, check what my extension is. I do have a little bit of bruising, as you can see right here, and you know, kind of throughout here there's some bruising. But my overall kind of thing to you, if you're thinking about getting ACL done, is do your research. When your doctor tells you what he's going to do, you know, do your research on it. You don't have to go with what he says. If I went with my first doctor who said, we're going to take your patella and we're just going to do it this way, I would have been one of those people who's laid up for a month because their knee is so weakened by having their patella taken out, so you lose the strength there, and then having your ACL taken out, and your whole knee, it's so painful because I do have pain here. There is pain in this graft, and I can't imagine stacking this pain on with this pain. You know, I'd be immobilized. But with this surgery, I'm up, I'm moving, it spreads the trauma out. I'm going to do rehab on both knees, so one's not stronger than the other. I've been pleasantly surprised at, you know, how well things have gone. And I'll show you, like I said, in the next video, I'll do some of my exercises. Weird things. That's my phone ringing there. Weird things that has maybe arose that I could talk about. The cryo cuff has been a blessing. It's kind of the thing they'll give you that stays on your knee and ices it. Use that as much as humanly possible. Massage, really massage your lower leg. Massage your lower leg, massage your quads a lot. Just really take care of yourself. Drink lots of water. That helped me a lot. You have to go to the bathroom a lot, but it actually helps you because you need to get up and moving. Oh, the other thing is I didn't have a brace. They didn't give me a brace. They gave me, I had 2 white stockings on, and some gauze. But they had me about a half hour after surgery. They got me out of my bed, put me on crutches, and had me walk up and down the hall, bending my leg, everything. So they didn't give me a brace. I went in to see them again. They measured me for an athletic brace. So like in 6 months when I play, I'll have that weird brace thing that like you see NFL players wearing. But my appointment in a week and a half is to go back to check my progress with my incision. They're going to give me a compression bandage, which is basically just going to be a compression thing to promote healing faster and stuff like that. So I think that's about it. If you have any questions, please ask. I'm on the computer 24/7. Like I said, me and my wife have our own business. that basically revolved around the computer. Please ask questions. And I'll try to keep this updated as much as possible. And sorry you had to stare at my gross knee there. Yeah, if you've had your ACL done and you're kind of struggling, don't worry about it, man. Push harder, go at it strong, do your exercises. If you haven't had your ACL and you're kind of down, don't be down. It was a quick process for me. Just follow your doctor's orders and do your research. Get the best thing possible out there. And most of all, feel comfortable with what you're going to do. So, thank you.